And we go back to Africa, where in Nigeria, women are being offered free cervical cancer screening in an effort to raise awareness about what health experts say is an easily preventable disease. Here at the George Kerry Life Foundation in Lagos, which specializes in women's health, women are encouraged to drop in at any time to get tested for cervical cancer. They can also get information on early detection of the disease. Dr. Matilda Kerry is the founder of the George Kerry Clinic.
Annually, we have deaths of about 8,000 and above women dying from cervical cancer, but the statistics even at 8,000 is pretty low because we know not every woman in Nigeria presents to the hospital or comes for medical treatment. So there are a lot of losses that we aren't recording in the hospital. But according to hospital records, we have about 8,000 Nigerian women dying annually from cancer of the cervix. That's about a woman every hour.
Cervical cancer screening takes no more than a few minutes. It involves a simple vaginal examination with the use of a harmless chemical to help highlight abnormal cell growth on the cervical wall, which could indicate cancer. Nurse Yetunde Ajiboye explains.
The process is called visual inspection with acetic acid. We use acetic acid to see after diluting and to see what's going on there. Naturally, the cervix is supposed to be pink in color, but once we apply the reagent and it starts turning to white, when we see white patches like something you can scrape off, then that means there's something wrong with the cervix.
Nurse Ajiboye talks to each of the patients before carrying out the test. She encourages them to have regular checkups and tells them to pass the knowledge on to their friends so they also come in for a screening.
You don't feel anything unless it has gotten to the last stage, because that is why it is so deadly, and women have to really be conscious of their health. That's why we are advocating that every woman should go for it, since it is the only cancer that is preventable, and I don't think any woman should die of it.
Word of the free screenings has spread fast. Women of all ages have been dropping in to get the tests. For some of the older women, like Theresa Akorede, it is the first time they have ever been screened.
I've been hearing from people that cancer is a very bad disease that causes some bad life to human beings. So it is good to check up and know whether you have it or not, so that the earlier, the better you treat yourself for it.
The current program has been limited to clinics in the Lagos area. However, Dr. Kerry and her colleagues hope to broaden their reach to other regions soon. And that's your report for today, Vincent.
Yeah, and I have to say that particular story is very encouraging. Indeed. And so we hope more women can get free checkups. Thanks a lot, Linord, for joining us today. Be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on In Focus.